Hi, I'm Dr. Mary Ellen Shannon from the Center of New Medicine. I'm here to talk to you about alternative treatments to breast cancer. Thanks for coming and thanks for listening in. I hope you can share this with your family and friends because there's a lot of us who could benefit from this information. 1 out of 8 women get breast cancer, so it's really important to learn your options and not just rely on your doctor. I know for a fact because I got a life-threatening illness 10 years ago where if I listened to the Mayo doctors, I probably wouldn't be alive right now. You need to be your own advocate. You need to educate yourself, learn all your options, and maybe outside the box. What I found that helped me was not what I was trained for as a medical conventional doctor. There's a lot more than treating cancer than just doing chemotherapy, radiation, and surgery. You need to know you need to make a lifestyle change. You need to change your diet, number 1. That's a fundamental foundation to helping yourself recover from a chronic disease. Your diet is so important because that's our basic building blocks in how we're preventing disease and how we treat disease. You need to avoid sugar, number 1. Sugar feeds cancer. It's very upsetting when you go into a conventional oncology office and see them serving donuts to their chemotherapy patients. This is contributing to your disease and you need to change your diet. So that's utmost important. And there's so many pollutants in our foods now. There's so many preservatives. There's so many chemicals. These chemicals that are in our foods are endocrine disruptors, and they're contributing to your disease by stimulating estrogen. The environment is filled with chemicals with xenoestrogens that is also causing a big burden on our body to process all these estrogens. So number 1, change your diet, and you need to change your lifestyle. Do you know if you drink more than 3 drinks of alcohol a day that you're at 1.5 times greater chance of getting breast cancer? You also, obesity is another thing that's that can contribute to breast cancer because in an obese patient you harbor a lot more estrogen. When you have a problem of estrogen dominance, it puts a huge burden on your body to process these estrogens and contribute towards breast cancer. So lifestyle change, watching your diet are important things. And also there's an emotional component to all chronic disease. And you have to address this because stress is a number 1 killer. We all have stress. I know stress put me into my chronic disease. And you have to pace yourself and balance your life. You need to get out there and exercise to release the stress that we're confronted with daily and change the way that you deal with your stress and not harbor it internally because it manifests in physical symptoms. I also, other options to treating breast cancer are, I went to Germany and was fortunate to study in photodynamic therapy. Photodynamic therapy is a therapy that has been around for 25 years. It's when we give a patient a photosensitizer which will help the cancer cells absorb the photosensitizer, and then we use a laser, a fiber optic laser. And this fiber optic laser will cause the energy within the cell to transform over into an aerobic metabolism. All cancer cells have low energy within them. And when we give a photosensitizer plus giving the light, like the infrared light is commonly what I use because it can penetrate through the skin 6 centimeters, and then you can also when I do ultrasound, and if someone has a tumor, I do an ultrasound guidance. I put a needle right into the tumor and put the photosensitizer in, followed by sodium bicarb, ozone, and then I thread in a fiber optic and do a laser treatment for 20 minutes on the tumor. And this is highly effective, especially for estrogen receptor and progesterone receptor positive tumors. Those I've seen excellent responses to. The triple negative and HER2 positive tumors are more aggressive and require other modalities other than what I do for the estrogen progesterone positive tumors, which are not as aggressive. This is photodynamic therapy is part of the puzzle to help someone treat breast cancer, but there definitely is, you gotta treat cancer from multiple pathways. You can't just rely on one modality, nor can you rely on just radiation, surgery, or chemotherapy. There needs to be, you need to address the whole body. You need to address the emotional component, the toxins that are in the body. I see a lot of breast cancer patients that have an underlying Lyme disease or have a mold infection. And if these go unnoticed and you just treat the tumor itself, you're going to have a reoccurrence. So to prevent reoccurrences from breast cancer, you need to strengthen your immune system. And how do you strengthen your immune system? You identify the burdens that it harbors, like infections, heavy metal toxicity, nutritional deficiencies. These are always, and then we are even doing testing that will tell you how well your natural killer cells are functioning. The natural killer cells are part of the immune system that are like the Pac-Man, the macrophages that help destroy things that are burdening the body. And natural killer cells functioning, if that is low, that definitely puts someone at risk of cancer, and it definitely makes it harder for them to fight their cancer. So recently we're going to get a test that we will do here that will tell us how well someone's natural killer cells are functioning. And then we have a baseline, a laboratory value to go on to, and then give them supplements or, that will help increase their natural killer cell function. This is highly important to prevent recurrence, because once you get a cancer, that's your body putting on a red light, like you're not living the right life, the life you should. You know, you need to change something. You can't just rely on someone doing surgery, radiation, and chemotherapy and saying you're cured. I see that every day where people have been treated conventionally and they're told they're cured, but they never change their diet, nor have they relieved their stress in their life. And it's common that they get a recurrence because the root cause of their disease has never been identified or treated. And this is a big major problem in the practice of conventional medicine. So I think people will need to address these things, and our environment is so toxic nowadays that cancer is definitely on the rise. I see breast cancer and prostate cancer definitely increased since I've been practicing because of all the xenoestrogens we have in our environment and the chemicals we have that are endocrine disruptors. So I will open any questions to anybody in the audience and also on Facebook, so I can help you with your problems. Yeah, sure.
Remember to repeat.
I will.
What about mercury in teeth fillings? Who should take those out? How do they do that?
Oh, mercury in teeth fillings, that's definitely something that should be done by a biological dentist, because they need to, if you don't have it done by a biological dentist, sometimes it could spill mercury systemically and become, it could develop a lot of neurological symptoms. So mercury fillings should be removed only by a biological dentist.
Is the photodynamic therapy available at your clinic?
Yes, the photodynamic therapy, her question was, is photodynamic therapy available in our clinic? Yes, it is, and I'm the one who does it. So I went to Germany last June, so I've learned about this system for almost a year now, and I think it's wonderful. I had a great friend who died of breast cancer, and I saw her wither away with chemo after chemo, and then she got another cancer on top of that. And I felt it was my passion to look for something else where I give people quality of life. And I know for myself, when you do treatments that work synergistically with your body's a miracle. It'll heal itself as long as you know what to give it and to help those things. And photodynamic therapy works synergistically. You're getting more light into the body and it's helping those cells recover.
Is that the same as LED light therapy?
Now it's an excellent question. Her question was, is photodynamic therapy LED light? LED light is a form of therapy that we do utilize once I give. So let me explain what I do. So I have a photosensitizer that is made from Germany, and it's called ICG. It's all natural. And this is a nanoparticle photosensitizer that will be absorbed and stays in the body for 5 to 10 days. And once I give this photodynamic therapy IV, then I want to heavily utilize the infrared light. So I do an infrared laser in the IV. I'll do infrared laser into the breast tumor if they have one. And then I also use a LED bed that we have here. It's kind of like a tanning bed, but it has LED infrared and red lights. And so that's highly beneficial because that is absorbed 6 centimeters into the body. So good.
Is it useful for sarcoma?
Sarcoma is a very difficult cancer to treat, but it is definitely beneficial to sarcomas because sarcomas don't respond to surgery and chemos, and it definitely is something that could be of benefit, but it wouldn't be the only thing you would need to do, right? Sure.
So you mentioned that the laser switches the cancer cells to aerobic metabolism, and I was wondering how that can benefit, like, eradicating cancer.
That's an excellent question. Her question was, how does the laser go into the cell and change the metabolism of the cell? Well, when we give a photosensitizer, it stimulates the mitochondria. And going back to biology 101, the mitochondria is the powerhouse of the cell, and the laser has been shown to incite what we call cytochrome C oxidase, which is part of the electron transport chain, which provides more ATP and energy to the cell. So I don't know if I answered that good enough for you, but so this has been studied extensively in Germany, and it's wonderful because the government actually sponsored the study. So it's not a drug company that's sponsoring the study. This is non-biased data that is produced from the government that studied the Weber laser. That's the Weber laser system is what I use. And there's a lot of information online, great YouTubes from the Weber Clinic. And they're wonderful people, and they have definitely a lot of science behind what they do. You think? Sure. Okay.
How do you detox metals, the liver, colon, is how she's saying that.
Heavy metals. First of all, heavy metals, you should have a provoked heavy metal test. So heavy metals stay in our fat. So if you just get a blood test and they say, oh, I have no heavy metals because I did a blood test. Well, that's not good enough because when we draw blood, it's not analyzing what's in our fat. So what we do is we do an IV treatment and we give you a chelator called EDTA and also a pill called DMSA, which are chelators to pull out the metals from your fat. And then once those metals are, then we collect your urine from 9 hours. That's how we diagnose if you have heavy metals or not. Now, depending on what metals you have, again, we use EDTA IV, or you can use EDTA rectally, or you can use DMSA orally. So those are 3 different ways to pull out the heavy metals. And the treatment is lengthy. It takes a while to pull out those metals, and then you'd want a binder like Corella or something to bind the heavy metals once you pull them out of the fat to get rid of them. Then you also, with EDTA, you want to make sure the renal function is good because it can be hard on your kidneys.
Okay. Is this similar to brachytherapy, are they saying? Brachytherapy?
I'm not yeah, I'm not sure what the BRCA, I don't know what that abbreviation, if you could tell me.
Let me try to
expound on that.
go in and look it up. Is there anybody with other questions?
Well, this BRAC is a genetic, people have a genetic predisposition towards breast cancer too. So some people could have a BRCA1 or BRCA2 gene that predisposes you to breast cancer. You could also have what we call a COMT SNP or a CY1B1 gene. Those are also causes you genetically to predispose you to breast cancer. When you have estrogen in your body, there's 4 different pathways the estrogen can be metabolized down to. And if your metabolization of your estrogens down what we call the 4-hydroxy pathway, it will increase your risk for breast cancer.
She's saying brachytherapy is also used for prostate cancer.
Brachytherapy is a radiation therapy. So no, this is not a brachytherapy. They use that conventionally for cervical cancer, for uterine cancer. I didn't know they use it for breast cancer. That's a radiation form of therapy. So yeah, they use brachy for prostate too. But this is not radiation. It has no downsides. It works with your body. It does not, very few people, I think the only side effect you could potentially have is an allergic reaction from the photosensitizer, which is very, very low. So and your quality of life is so great because you feel so good with these treatments. Some people may feel a little tighter, but it's nothing like going through chemotherapy, radiation, or surgery.
You mentioned DMS, was it DMSA or
Yeah.
DMSO?
DMSA. DMSO is a substance that we use to help help the depth of absorption of a treatment. DMSA is actually a heavy metal chelator. Okay, a great question.
Tucker, did you go into for just prevention on the breast thermography versus a mammogram?
Sure. In my opinion, the way to prevent breast cancer is with thermography, because you're not exposing yourself with radiation. So then you say, what's thermography? Thermography is a heat sensing ability, because what happens when you have a breast tumor, you have high vascularization. The tumors have a lot of blood supply to it and they heat up. So thermography is a good surveillance. Another way to prevent breast cancer is by identifying if you have a BRCA gene, of course, or if you have a CY1B or a COMT genetic SNP, then you take a supplement called DIM or I3C. DIM is actually made of cruciferous vegetables, which has been shown to help the metabolization of estrogen down the right pathway, which won't predispose you to cancer. Sure.
With the thermography, should you have it done annually as a mammogram?
Yes.
Or is it done sooner?
The question was whether she should have mammography done annually or should it have it done sooner. Thermography should be done annually unless it was abnormal. Then you'd want to, if we get a Th3 or Th2 result, they'll recall you back in 6 months. So Th2 sometimes can just be because your hormones are off. If you have a Th3, we usually recommend to follow up with an ultrasound and a mammogram at that point. But doing mammograms yearly can predispose you. It's too much radiation, in my opinion. Mm-hmm.
Are there any imaging techniques or other diagnostics that you recommend for surveilling for recurrence?
That's a great question. Her question was what I would recommend for surveillance of breast cancer. Well, one would be the natural killer cells that I just spoke of, because if we're maintaining a good immune system, everybody's confronted with cancer. It's when your immune system goes down when it predisposes you to cancer. So if you didn't have any tumor markers, some cancers will be able to follow with a tumor marker, but I have a lot of patients that don't have any tumor markers to follow them. So then I will follow them with the natural killer cells. I'll follow them with a PHI test. PHI is a blood test which tells us the anaerobic activity. And as I said, all cancer works on an anaerobic metabolism. So nagalase is another way I could follow, because nagalase is an enzyme that all cancer cells produce that impairs the immune system. So as your cancer is going away, your nagalase should go down, your natural killer cell function should improve, and then your PHI should go down. Then another way we could follow is with circulating tumor cells from the test in Greece. It's called RGCC. And so we could see what their natural killer cells, their circulating tumor cells are, because those should go down too. We also have bioenergetic testing. So Dr. Finney's here in the clinic that she does cancer cascade or 3D body imaging, which will show improvements as your disease improves.
Do you ever use the main track test?
Main track test. No, I'm not familiar with that. Main track.
Tests in Germany.
I'm not familiar with that one. That's not a common one that we use, but we are looking at other tests. Maybe you can teach me about that.
Yeah, they use that in some German clinics.
Oh, great.
And do you ever use a CA profile?
Yes, absolutely. Those are common tumor markers. CA profiles are different tumor markers, but they're not always positive. CA 1927, CA 125 for ovarian cancer, but they're just markers, and they're not always elevated. So, but yes, we will if we have those. That'd be a great way to check for reoccurrence. Mm-hmm. Anybody else?
The PHI test.
Yes.
Is that just a blood
It's
test?
great question. The question is, what is a PHI test? A PHI test is a blood test, and it will tell us the anaerobic activity of in your body. And the more cancer you have, the higher your PHI will be. So it's another marker we can follow. It's a specialized test, and I think it roughly runs around $100 or something like that.
The bioimmune, can you tell me a little bit more about the bioimmune test?
Sure. She's asking about the bioenergetic test that we do here in the office, and it's done by Dr. Finney. And what she does is energetically she goes along the body's meridians, and she puts in a frequency, and we know that every organ in our body has a certain voltage, and so she's able to identify imbalances what you have. When you have cancer, the voltage in the cell is very low. The energy in the organs are real low, right? So as your cancer regresses with treatment, the energy in the cell will improve. So that's kind of an easy way to kind of tell her what her it's much more complicated than that. That's outside my expertise, so to speak, but she could go into it. And I know she has a lot of videos on our website, Dr. Finney, and she's great, and I'm a strong believer in her. I was her guinea pig when she was interviewing here, and I was totally impressed because I had so many medical problems. Dr. Keneally said, "Mary Ellen, go be the guinea pig, see what she picks up on you." She picked up my osteoporosis in my 10th thoracic vertebrae. And I was blown away because, being from conventionally trained, I thought this energy stuff was a bunch of hooey. Well, it's not. It's very valid. It helps me hugely because you don't have to do all these lab tests to identify things. You can save a lot of costs when you know where the imbalances are in the body. So I use Dr. Finney a lot in helping people. Good.
Somebody's asking about how do you test for, what test is performed to test nagalase levels?
What test is performed to test nagalase levels? Nagalase is also a blood test, and that is probably roughly around $150. And as I said before, nagalase is an enzyme. It increases with cancer. It can increase with chronic infections. It's an enzyme that impairs the immune system to function. So we want to try to bring down that nagalase level, and we can do that with a substance called GCMAF or bravorectal suppositories or salicinium. Those are different modalities that can help us lower the nagalase level.
Somebody's asking about CBD oil.
Oh, so the question is about CBD oil and how that plays a role in treating cancer. CBD is excellent. You've got to approach cancer in many different ways, and there's no magic bullet. Dr. Keneally always made the scenario that it's like a sinking boat with multiple holes. You can't just plug one hole. You got to work on everything. CBD is great as pain management. There's Rick Simpson's oil. There's a protocol for CBD. I don't think it's the only thing you should do, but it definitely is something that works synergistically with the body to heal itself.
People are out of the state, and many people are asking how they would interface with us if they wanted to get a test done. So we do remote consults, maybe go over that, and then how they would go about. They would get their test. You would do something.
Sure.
Can you go over that, and then they could actually work with us here.
Oh, sure. The question is, how do I do all this testing if I'm from out of state? We do phone consults. We do Skyping. A majority of our patients are from out of town. And we can tell you what test to order. Sometimes we have people from Texas that can draw the RGCC that we work with. So what we do is set up a phone consult or Skype, and then we tell you what our recommendations are based on your history.
And then there's the name of the test that tests the Nagalese
Well, it's called Nagalase.
test.
Yeah.
Okay, what is the test that tests NK cells?
The natural killer cell function test is done here in Irvine, and it's a new lab that has been set up that has been studying the natural killer cell function. We just got a webinar on it. One of the doctors came over and told us about it. It is a lab of one of its kind. You'd have to get the natural killer cell function here. It's not a number, it's more how the natural killer cells are functioning, because that's impaired whenever you have a chronic disease. And that test probably costs about $185.
Okay.
Okay.
Anything else?
All right. Well, thanks for joining us. And if you have any questions, feel free to call the office. And I hope you enjoyed this. And I hope I educated you on a few things on options to treat your breast cancer. Have a good night.